And so that brings us to In Focus tonight, and In Focus is battling COVID with determination. Battling COVID with determination. To discuss this, we have Dr. Naveed Wig, Department of Medicine at the All India Institute of Medical Sciences, and Dr. Rajiv Sood, who is the Dean of RML Hospital and the Atal Bihari Vajpayee Institute of Medical Sciences. Thank you very much, doctors, for being with us. Dr. Wig, we'll start with you. Are you encouraged by the ramping up of facilities for one, and also the fact that we have so many, we are seeing a very high recovery rate? I mean, the number of people who are recovering is growing by numbers.
Yeah, I'm satisfied with the way the response is being given. And you see the way testing has been ramped up. We still need much more testing, because the game is testing, then tracking, isolating, and then treating them. So treat them early. And if you look at the number of beds, we have sufficient number of beds. Then if you look at the number of testing are being increased. So that will help us to detect patients early, and that will help us to manage them faster. And then these are my beginning of remarks, because we don't want patients to come late. The whole problem has been patient coming late to the hospital. The patient has to come early. I will not say that very early. I don't want asymptomatic and very mild patients to come to the hospital. I want patients who have a moderate disease, who are feeling, some tightness in chest, whose cough is little more, and who has got some respiratory rate is little faster, more than 20, or saturation is less. Only these patients should come to hospital, and then these are the patients who should be managed in hospital. Rest others can be taken care at peripheral centers. So for tertiary care place, we have definite plan. For mild patients, we have another plan. For asymptomatics, those who can remain at home, or mildly symptomatic, those who can remain at home. So home isolation is another.
So Dr. Rajiv Sood, let's talk a little bit about the patients who are at home and who are in isolation. I was talking a little bit about a situation where people suffer from a lot of anxiety. A lot of people are in self-isolation even with symptoms, and they isolate themselves because they are not able to go and test. Now, of course, the number of tests have increased, but it was a little earlier, it was a little difficult. How would you understand, have we actually crossed this challenge where, people who are living at home have been able to deal with the virus and have come out successful?
Actually, I'll share with you that I myself suffered from this, and I know it better that what happens in a hospital, because I'm managing the COVID patients there and the facilities. Now in hospital, the challenges are different. There are basically isolation, and not only isolation, they are the staff and patient interaction is not that frequent, that rounds are there and other things. They feel that they are better to be tackled. And what we have done, we have created the facility of telecounseling. All the patients who are admitted, they are connected to the telecounselor and the psychiatry department, and we are very, very successful. Initially, the panic was there and they were isolated, depression was there. Now in the home, what is happening, that either you are in, if you have 3 people have corona, they can live together with social distancing, that is all right. But if you are exposed, you have to be totally in isolation so that you are not getting the infection from the other person. And at this time, as was mentioned earlier, the old hobbies, maybe chess, ludo, carom, or other things, they are very, very beneficial. Reading books and writing skills, those who have or who want to innovate, painting, other things can be introduced. We should see to it what are your preferences, what are your choices, and even in isolation, you don't feel isolated. So mental health, mental support system, willpower to fight with the disease is very important. The other thing is that the reporting, as just has been told by Dr. Naveed, that only patients who are moderate to severe,
Yes,
they should
yes.
rush to the hospital, or I'll add that the patient will comorbidity or the above the age of 60 years or so they should go to the hospital. But others, home care is familial and familiar
Okay.
atmosphere, and these are the two things that they will, even if your family members are not in your room, they are at distance, or they are helping, but your mental support system is there. And
Absolutely.
also, if you are mildly symptomatic, one trend recently which I have observed, some people are now contacting that I don't have symptom. When we consult like that, they say that I don't want to go for test. That is
Okay.
also wrong. We will not get the exact number, and asymptomatic people who are suffering are dangerous for the society and other people.
Absolutely.
And then if you are not reported, you will not come in the Arogya Setu also. We
Right.
will not know that which house, which area, and who are the family members who are to be quarantined, the
Okay.
close contacts. So this will destroy the system. The lockdown was there, now lockdown has been relaxed, and therefore it is very important the self regulation and self discipline. Three
True.
mantras which has been given: the social distancing 6 feet or more, the mask, and also either face shield or the eyes are to be covered. These are very important for the health workers. We
Okay.
are having, in spite of all the precautions, the casualties or the infections in the health workers. So you can understand how
Right.
contagious this virus is.
Right.
That as far as the
Sure.
recovery is concerned, it is becoming very good. We are
Yes.
testing more and more, and we
Yes.
are catching early, and the treatment also we have better understanding now, and every day it is improving, and doctors are very confident that they are able to handle all kind of situation. The infrastructure, the beds are improving.
Right.
We need to
And that's very
concentrate
encouraging for
on
people as well.
manpower. Yeah.
Very encouraging for people that the treatment seems to be working. But Dr. Vig, talking about that treatment, people who are, let's say, mildly symptomatic, people have, because of the situation, I was talking about the mental situation as well. People have stocked up, on, let's say, vitamin C, on Giloy, on all these kind of traditional medicines as well. And they have been taking them in some sort of quantities. Is that something that, has also helped in a way in, let's say, people who have probably not had too many symptoms or perhaps have dealt with this virus quite easily? Is that something that we should look at?
So, today is Guru Purnima, right?
Yes, 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 indeed.
So we have to become Corona Gurus. Corona Gurus, right? So these 3, 4, 5 months have given us a chance to understand our health. And we should use this more to understand our health and our perspective. We should not self-medicate. Rest, vitamin C is a harmless drug. There are few drugs which are harmless, and so those which are harmless can be taken, but we should not self-medicate ourselves. For me, the mantra is hydration, hydration, and hydration, and a normal light diet during these times, doing your exercise regularly for 40 to 45 minutes, and spending quality time with your closed ones, and staying at home. We have learned a lot about this disease. We have to remain indoors, and we have to socially isolate inside home also, because we know this virus is highly transmissible. If we go to outdoors and if we go in a groups, then it is highly transmissible. So we have to avoid self-medication, and we should try that, we should not over-medicate ourselves by different drugs.
Okay.
Because, and whenever you get sick also, again, then don't self-medicate. That's what it is.
Right, but there are people, because this is a time, Dr. Dr. Sood, there is a time when we're getting a lot of other kinds of illnesses because it's raining, the weather is changing, it's very humid. People may, misunderstand that just a regular cold is actually the virus, and the tests are kind of expensive even now, 2,400 rupees in the private sector. people keep trying to, they can't go and test themselves all the time. So what are they supposed to do?
Actually, this is the time, you are right, that when various viruses are there every year, we in our hospitals, we have swine flu ward and other elements, they are coming. But you know that till February, the national number of diagnoses for swine flu, which was increasing till February, and it was even 6 Supreme Court judges were also affected. And after that, the number has started going down, because the precautions which we are teaching for corona are
Yes.
valid for the other viral infections also, and even other infections, even bacterial infections. So hygiene, hand washing,
Yes.
the sanitizers, social distancing, fomite care, that whatever we are handling, this has brought the number down, and we are getting less cases of the other type of viral infections. The
Exactly.
second thing is, the second part which you are asking is that any cold or flu like symptoms, they can be there, but if they are associated with fever, and if your loss of taste,
Taste
loss
and
of
smell,
appetite
yes.
is there, then it can be corona, COVID-19 infection. So we have to be, the sense of smell is going or taste is going, and weakness is there. You undergo testing, and if you go to hospital, private labs are giving quick testing by paying. But in the hospital, it is government hospital, it is free of cost wherever it is feasible. We should approach that. We should not ignore, because it was rightly said that if we think that I am invincible and I cannot get affected, and this was the feeling I suffered once myself, malignancy, chemotherapy, and I came out. So I thought corona cannot hit me. I was front line warrior for 3 months. I was working, and one fine day I got infected, and I had to get hospitalized for 2 weeks. So that is different situation.
Yes,
You have to be very, very careful. One moment, the carelessness will spoil your 3 months effort, or a national lockdown, everything.
Absolutely.
So we have to be very
Yes, indeed.
careful. We have to be vigilant. And one message I want to give, that plasma therapy, the immunity we want to give, immunity is either by vaccine or by herd immunity, when most of the people get affected and antibodies develop. But in the early part of that, mind it, I'm telling early part of the disease, if it is going for symptomatic, then plasma can be useful. But people are thinking plasma therapy is something very, very dangerous thing. How we'll get plasma? You see, there is regularly so much donation, blood donation, and plasma is part of that blood donation only. It is nothing plasma therapy, it is only blood donation. And I'll appeal to all corona patients who are now in thousands and in every city. They should come like they were donating blood. If they donate blood again, one component will go for corona care, and other components will go for other ailments, operation, other thing, and it is only blood donation.
I think that's all the time we have for Dr. Rajiv Sood, Dean of RML Hospital, and Dr. Naveed Vij, Department of Medicine at All India Institute of Medical Sciences. Thank you for being with us and help us understand the situation with regard to corona.